begins, the radiographer must assess the patient and evaluate their medical history. This step is essential for understanding any existing condition that could affect the procedure. The radiographer then prepares the patient by explaining the imaging procedure and assists in preparing for the examination. This includes making sure that the patient is comfortable and is informed of the steps to follow. Another vital responsibility is screening patient, as the radiographer must check for any contraindication that could make the exam risky, such as pregnancy or allergies to contrast agent. Furthermore, the radiographer collects important patient information such as medical records and personal details, ensuring that all relevant data is recorded. Finally, the radiographer justifies the referral for the imaging exam, ensuring that it is medically necessary and optimized for the best result. During the exam, the radiographer performs the procedure using the suitable imaging equipment to produce high-resolution diagnostic image. It is also important to monitor the patient throughout the exam to ensure that their comfort and safety. The radiographer should pay close attention to any issue the patient might express and resolve them quickly. Protecting the patient from radiation exposure is another key responsibility. This is achieved through proper use of shielding and ensuring that only the necessary amount of radiation is applied. After the exam, the radiographer analyzes the image to ensure they are clear, accurate, and useful for the doctor's diagnosis. Once the images are reviewed, the radiographer shares the result with the doctor to support the patient treatment plan. Equipment maintenance is also essential. After each exam, the radiographer cleans and sanitizes the imaging equipment to maintain hygiene and functionality. Finally, documenting all activities is important for maintaining accurate records such as patient doses and other relevant information, which ensure that there is a complete and accurate history of procedure. Medical ethics and professionalism. Ethics is a branch of study dealing with what is the proper action, right or wrong for individual interacting with another person. Medical ethics is a branch of ethics that pertains to medical practice. It is a moral regulation and ethic principle for professionals dealing with patients.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Afika Zahra, and now I will be explaining about Code of Ethics. One of the Code of Ethics is professionalism. It encompasses a healthcare professional's commitment to competence, accountability, and respect for the individuals they serve, advancement in medical science, and continuously honing their skills. By exemplifying professionalism, healthcare workers put trust and confidence in a healthcare system. Second of Code of Ethics is morality. Morality refers to the principle of right and wrong that guide decision-making in the medical field. This involves providing all necessary information for patients to understand their medical conditions, treatment options, and potential risks. Justice is another key of moral principles, require fairness in the distribution of healthcare resources and ensuring that every patient receives equitably care regardless of their background or socio-economic status. By adhering to these moral values, healthcare providers build a strong ethical foundation for their practice. Next is good communication with patients and their families. Effective communication is essential in healthcare. Good communication involves not only conveying information but also actively listening to patients' concerns, preferences, and emotions. It ensures that patients feel valued and understood. Strong communication skills enhance patient satisfaction, improve adherence to treatment plans, and lead to better health outcomes overall. Next is practice radiation safety for patients, staff, and the public. Radiation safety is a critical aspect of medical ethics, particularly in fields such as radiology and oncology. Medical professionals must prioritize minimizing radiation exposure to protect patients, healthcare staff, and the public from potential harm. Additionally, strict safety protocols must be in place to protect healthcare workers who are frequently exposed to radiation and to prevent unintended exposure to bystanders. The fifth Code of Ethics protect patients' records. Patient records are a vital part of medical practice, containing sensitive information that must be safeguarded to protect individuals' privacy. Healthcare institutions must invest in secure systems to prevent data breaches or hacking attempts. Additionally, clear policy should govern who can access patient records and under what circumstances. Protecting patient records not only preserves confidentiality but also maintains the trust that patients place in their healthcare providers. Ensuring that accuracy and integrity of records is equally important as it directly impacts the quality of care delivered. The last code of ethics is confidentiality of patient information. Confidentiality is a cornerstone of medical ethics, ensuring that sensitive patient information is not disclosed without proper authorization. Healthcare professionals are bound by ethical and legal obligations to keep patient information private. This includes safeguarding medical histories, test results, and any other personal details shared during consultations. Information should only be shared with other healthcare providers involved in their patients' care or in specific circumstances such as legal obligations or public health emergencies. For the next topic, I will be explaining about the principles of medical ethics and professionalism. One is to provide service without discrimination. Healthcare professionals must treat every patient equally and without prejudice, regardless of factors such as age, gender, race, religion, social status, or the nature of their illness. Discrimination in their healthcare can lead to inequities in treatment and diminish trust in the healthcare system. By providing service without bias, professionals ensure that every individual has an equal opportunity to receive the care they need. Second is respect for patients. Respecting patients means acknowledging their inherent dignity and treating them as individuals with unique needs and emotions. This involves listening to their concerns, addressing them by name, and maintaining compassionate attitude. The third one is responding to patient needs. It involves understanding and responding to their physical, emotional, and psychological needs. This principle requires healthcare providers to go beyond technical competence and engage in empathetic and patient-centered care. Fourth is radiation safety. Limiting radiation exposure is critical in radiology and imaging service. This principle emphasizes the importance of balancing the diagnostic benefits of radiology with responsibility to protect individuals from potential risks. Fifth is avoiding diagnosis by non-physicians. Non-physician healthcare workers, such as radiologic technologists, should avoid diagnosis patients as these fall outside their professional scope. Misdiagnosis or misinterpretations by unqualified individuals can lead to confusion, anxiety, or incorrect treatment to the patients. Sixth is patient privacy and confidentiality. Protecting a patient's privacy is one of the cornerstones of medical ethics. Healthcare professionals are entrusted with sensitive information, and safeguarding this trust is paramount. Confidentiality means that a patient's personal and medical information is not shared without their consent unless mandated by law. Seventh is acting as an agent. In the medical field, healthcare professionals often serve as intermediaries between patients and physicians. They gather crucial information through observation and communication, ensuring the physician has accurate and reliable data to make informed decisions. Next is effective communication. Miscommunication can lead to errors, delays, or inadequate treatment. By fostering clear, respectful, and timely communication, healthcare professionals create a cohesive environment that supports patient safety and efficiency in care delivery. 9 is the use of appropriate techniques. Proper handling of imaging tools and adherence to protocols ensure that images are clear, accurate, and suitable for diagnosis. Poor quality radiograph can lead to repeat procedures, increased radiation exposure, and delayed diagnosis. Next is patient assessment. Assessing a patient's conditions before, during, and after medical procedures is vital to detecting potential problems and ensuring their well-being. Early detection of issues can prevent emergencies and improve patient outcomes. The last one is continuous learning. The medical field is constantly evolving with technologies, techniques, and treatment emerging regularly. To stay competent, healthcare professionals must engage in lifelong learning by participating in educational programs, attending workshops, and staying updated with the latest research.
My presentation will focus on two aspects, which are patient right and sources for the patient radiological examination. Patient rights are informed consent. One of the basic concepts of autonomy when providing and receiving healthcare is the right to accept or refuse treatment. The patient must be able to choose how they receive treatment from the healthcare providers. It is the responsibility of the healthcare providers to ensure that patients receive all the information needed to make an informed choice. Patient rights are essential in healthcare, particularly in radiography, when procedures often involve sensitive examination and advanced technology. One of the key factors in ensuring that a patient's right is protected by ascertaining that the patient has been given the opportunity to sign an informed consent. Informed consent is obtained after ensuring that the patient receives all the pertinent information related to the procedure. These include why the patient is receiving the examination, its potential benefits, associated risks, and available alternatives. The patient must be allowed to ask any questions or clarification that need to be make an informed choice regarding the radiological examination that they are about to receive. Informed consent is particularly important in radiology, where procedures such as CT scan or interventional imaging may involve exposure to radiation or invasive techniques. Informed consent is particularly important in radiology, where procedures such as CT scan or interventional imaging may involve exposure to radiation or invasive techniques. Another form of patient right is the right to refuse treatment. The right to refuse treatment empowers patients to make decisions about their care. Patients can decline a radiological examination or procedures even after being informed of the risk of not proceeding. This decision must be respected by the healthcare team. Patients may choose to leave before healthcare evaluation, refuse hospitalization, refuse particular tests or therapies, or refuse all medical management. Finally, patient rights includes privacy and confidentiality. Healthcare professionals must maintain patient privacy and confidentiality at all times. Protecting patient information is the responsibility of every healthcare provider. Sensitive patient information must be protected from unintentional exposure. Only those directly involved in patient care should have access to the patient medical records and personal details. Digitalization and sharing of patient information have privacy implications that need to be addressed and fixed with modified provision. This presentation will address the patient sources for radiological examination. Patient may receive radiological examination through several sources. Two primary sources are inpatient radiological examination and outpatient radiological examination. Several other sources include screening program, referrals from various specialty clinics, inpatient radiological sources. Inpatient radiological examination is performed for patients who are admitted to the hospital for various illness, and the radiological exam are performed based on areas of concern or to confirm a specific diagnosis. An example of this is a chest X-ray, which may be performed for patients who present with symptoms of severe cough and difficulty in breathing. Other diagnoses that may be confirmed using radiological exam, such as ultrasound, are kidney stones. Outpatient radiological sources. Outpatient radiological examination can be performed in various settings such as outpatient clinics or health clinics. This includes both government clinics as well as private clinics. Patients who receive their radiological examination in clinics may not require hospitalization, but the radiological tests may be necessary to help with the treatment plan or as part of their health screening. Screening programs. Selective patient population group may require routine or specialized radiological exam as part of the screening program. An example of a radiological exam that may be performed during a health screening program includes an ultrasound to detect kidney stones or gallstones. Mammograms are also a part of routine health screening for females above 40 years of age to detect breast cancer. Chest X-ray are sometimes included as part of pre-employment screening for tuberculosis.
Hi everyone, my name is Amelia and I'll be talking about the patient registration and distribution process of the examination in a medical imaging department. So firstly, I will talk about the breakdown of the process. So first is the request of an examination. The doctor in charge would request for an examination to the radiology department. This process will be done through the health system or written prescription. Once the patient is prescribed for the examination, the patient will have to go to the radiology department either as an inpatient or an outpatient. So secondly is the demographic information and verification. The patient must fill up a demographic information form which contains their name, IC number, date of birth, and medical history and extra. So this medical information will be then verified by the medical staff to ensure that it contains accurate details about the examination, referring to the physician and any clinical indications. Next is the patient consent form. The patient consent form will be asked to sign a form. This is to ensure that the patient is fully informed about the nature of the examination, including its purpose, patient risk, benefit, and alternative information. By signing this form, patient demonstrates their understanding and willingness to undergo the examination voluntarily and not forced. So next will be about the breakdown of the distribution. So firstly is examination scheduling. The registration information, the patient's demographic information, and their reason for the examination will be entered into the radiology system based on its urgency, clinical need, and patient's condition. Urgent cases such as trauma or acute conditions are given priority first. The staff will assign the patient to a specific image modality such as X-ray, CT scan, MRI scan, ultrasound, or based on their medical request. Secondly is the patient's preparation for the examination. The patients are required a specific preparations before the examination such as fasting, bowel cleaning, and removal of jewelry. The staff will also provide necessary information and instructions to ensure that the patients are adequately prepared. Once they are prepared, the patient will be assigned to an available X-ray room with the appropriate imaging equipment and necessaries for the examination. So thirdly is the assigned radiographer. The radiographer will greet the patient, review the request of the examination, and explain the procedure to the patient for their understanding. The qualified radiographer will then perform the examination. Once the examination is completed, the X-ray image is processed and reviewed by the radiographer. Why? It is because to check the quality and also to make sure that the image is clear for the interpretation. So lastly is radiologist interpretation. This image will be then sent to the radiologist, a specialized doctor. The radiologist then generates a report based on the discovered patient's image. The report will be then sent to the referred physician or doctor and becomes a part of the patient's medical record. Once the report is received by the referred physician or doctor, the patient will be called to receive their report and outcome of the diagnosis and treatment as well. Thank you. Hi, here I will talk about the types of X-ray room based on the types of examination. So the first room is a radiography/X-ray room, also known as a general X-ray room. This room is used to do a normal chest X-ray, abdominal X-ray, and bone X-ray. Second room is a fluoroscopy room. A fluoroscopy room is used to examine barium swallow, barium enema, angiography, and myelography. Myelography is an examination used by injecting contrast dye to see spinal stenosis, malignant tumor, and etc. Same goes for angiography, is also used by injecting a contrast dye. Third room is a computed tomography, also known as a CT scan room. A CT scan room is used to scan a chest scan, an abdominal and pelvic scan, head scan, and spine scan. The fourth room is known as a nuclear medicine room. The nuclear medicine room uses radioactive tracer materials. So this is used to examine thyroid scan and detect nucleotides, bone scans, and also lung scans to see pulmonary embolism. So the fifth room is a mammography room. A mammography room is specialized to use for breast X-ray to examine for any early detections of breast cancer or any sorts of breast disease to the patient. So the sixth room, the last room, is known as the ultrasound room. The ultrasound room is used for obstetrics to monitor fetal growth and development, and we also use it for cardiology. This is to see the heart structure and its function. And lastly, the ultrasound room can also be used as a abdominal imaging to examine internal organs. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurkisina Fatihah binti Mahisham. I'm going to present about type of X-ray examinations that need appointments. Firstly, computed tomography CT scans. Unlike standard X-ray, CT scans frequently requires contrast agents to enhance image clarity, which necessitates prior patient preparation such as fasting or allergy testing. The complexity of these procedures and the need for precise scheduling make appointment essential. Next, magnetic resonance imaging (MRI). Since MRI does not involve ionizing radiation, it is preferred for certain conditions. However, MRI requires careful scheduling to account for equipment availability and patient-specific considerations such as metal implants, which may pose a safety concern. Patient may also need preparations such as fasting for abdominal MRI scans or the administration of contrast agents. Intravenous urography (IVU). IVU is a specialized X-ray procedure used to evaluate the urinary system, including the kidneys, ureters, and bladder. During this procedure, A contrast agent is injected into the bloodstream to enhance the visibility of the urinary tract on X-ray images. IVU requires appointment because patients must adhere to specific preparation protocols such as fasting and bowel cleansing to ensure clear imaging. Additionally, a healthcare provider must assess for potential allergies to contrast medium. Next is fluoroscopy. Fluoroscopy provides a real-time imaging of the body and is often used to examine gastrointestinal GI tract or guide interventional procedures. Patients undergoing fluoroscopic procedures, such as barium swallows or enemas, must follow strict preparation protocols, including dietary restrictions. The specialized equipment and expertise required further underline the importance of scheduling these procedures in advance. Angiography. Angiography is used to visualize blood vessels and diagnose cardiovascular conditions. It involves injecting a contrast agent into the bloodstream and capturing images of the vascular system. Appointments are necessary to prepare the patient for sedation, monitor vital signs, and ensure the availability of a trained interventional radiologist. Mammography. Mammography is a specialized X-ray technique used for early detection of breast cancer. These procedures often need to be scheduled in advance due to the specific equipment required and the need to coordinate with a radiologist who specializes in breast imaging. Regularly scheduled mammogram also ensure better patient outcomes by enabling early detection of abnormalities. DEXA scans measure bone density and are commonly used to diagnose osteoporosis. Appointments are necessary because the procedure requires calibration of the equipment and preparation of the patient, such as avoiding calcium supplements prior to the scan. CBCT. CBCT is primarily used in dental and orthodontic imaging, providing a detailed 3D images of the teeth, jaw, and the surrounding structure. Due to the specificity of the equipment and the need to tailor the scan parameters for each patient, scheduling is essential. Definition of in- and outpatients. Inpatients. A patient who is admitted to a hospital or a healthcare facility for treatment that requires at least one overnight stay. Outpatients. A patient who receives medical care or treatment without being admitted to a hospital. Appointment system for inpatients. First, coordination between departments. Inpatient imaging appointments are typically coordinated by hospital staffs, including physicians, nurses, and radiology department. Second, bedside communication. Hospital staff informs the inpatient and their families about the scheduled procedures. Next, flexible scheduling for emergency. Appointment system for inpatient often include flexibility to accommodate urgent imaging requests. Lastly, EHR. Many hospitals integrate appointment system with EHR platform, enabling real-time update and streaming communication between clinical teams and the radiology departments. Appointment systems for outpatients. First, centralized booking systems. Outpatient appointments are often managed through centralized booking systems, either via online portals or call centers. Next, pre-procedure instructions. For specialized imaging procedures, such as abdominal ultrasounds or IVU, patients receive clear instructions on preparation, including fasting or drinking water before the scan. These communications are communicated during the appointment booking to ensure compliance and image quality. Next, appointment prioritization. Outpatient appointments are prioritized based on their urgency and complexity
of the procedure. Next, digital notification. Many facilities use automated system to send reminders via email, phone call, or message. Lastly, specialized time slots. Outpatient appointment system often allocate dedicated time slots for specific imaging modalities or patient categories.
Hi and Assalamualaikum. I'm Emilia Afika binti Arman. So I'm here to talk about some patient preparation before radiological examination. So I separate this topic into two types, which is general preparation and specific preparation. So first, let's talk about general preparation. For general preparation, first is about clothing. Patients need to wear loose and comfortable clothing. In many cases, the patient will be asked to change into the healthcare gown for accurate imaging and better radiograph. Second, remove metal objects. Patients need to take off their jewelry, watches, pins, hairpins, and any other metal items that might interfere with the imaging process. Third is medical history. Patients need to inform the doctor and radiographer about their medical history, such as surgeries and any implant. Third is medical history. Patients need to inform the doctor and radiographer about their medical history, such as surgeries and any implant. Fourth is hydration. Patients need to drink plenty of water to keep the body hydrated. And the last one for general preparation is inform the radiologist, which is inform the medical team about your allergies, medication that you are taking, and either if you are pregnant or not. Next, let's jump into the specific preparation. First is for X-ray. First, for X-ray, there's no any special preparation because most X-ray don't require any preparation but will be asked to remove any metal objects and wear gowns. Second is contrast media use. If the procedure involves contrast medium, the patient need to fast for 8 hours before the exam. Next is ultrasound. First, abdominal ultrasound. Patients need to fast 6 to 8 hours before the exam to ensure the stomach and intestine are empty for clearer image of abdominal organs. Second is pelvic ultrasound. Patients may need to drink water before the exam to fill the bladder for better visualization of the pelvic organs. Third is CT scan, which is computed tomography. First, fasting. Patients need to fast for 4 to 6 hours before the exam, especially if the contrast dye is being used. Second is hydration. Patients need to drink plenty of water before and after the procedure to help the contrast agent out of the patient's system. Based on the procedure, bowel preparation might be necessary. For barium enema, might be to clear may be required. For barium enema may be required to clear the bowel. Second is fasting. Patients need to fast for several hours before the exam. And the last one, which is the third one, is hydration. For some procedure, drinking contrast medium might be necessary to improve the image for fluoroscopy. To improve the quality of image in fluoroscopy by making it easier to differentiate different parts of the body. Next are preparation for MRI, which is magnetic resonance imaging. First is implant. Inform the radiographer if you have any implant because it can be contraindicated MRI. Next topic that I will explain is about patient care before, during, and after radiological examination. First, let's talk about the patient care before the radiological examination. Before the radiological examination, the radiographer need to do patient identification, which is confirm the patient name, date of birth, and any medical record. Next, medical history will be asked and screening will be done to understand about the patient medical history, allergies, and any prior surgeries. For procedures that involve radiation like X-rays and CT scan, they will ask and check if the patient is pregnant or breastfeeding, as radiation can be harmful to a fetus. Furthermore, the radiographer will provide clear instruction to the patient, such as informing the patient what to expect during the procedure, like how to position themselves and the need to remain still. Moreover, for certain procedures, especially those involving contrast media, it is essential to obtain informed consent from patients. Next is patient care during radiological examination. During the radiological examination, the radiologist or radiographer will guide the patient into the appropriate position for the imaging procedure. The patient must remain still as possible to make sure the images are clear and accurate. Other than that, the radiographer should always follow the principle of as low as achievable, which means minimizing radiation exposure to the patient. If applicable, the patient will be given a protective shield to protect part of the body that don't need imaging to protect them from radiation. Moreover, communication and reassurance also should be given to the patient to make sure that they stay calm and follow the instruction that given by the radiographer, such as to hold their breath, stay still, and adjust the position to ensure accurate imaging. For procedures requiring sedation and anesthesia, the radiologic team must closely monitor the patient vital signs throughout the procedures and after the procedures. If the patient was sedated, they should be allowed time to recover the supervision until they are alert enough to leave. Also, throughout the examination, it is important to respect the patient privacy and dignity by providing gowns. Next is patient care after radiological examination. After the radiological examination, the medical staff should monitor the patient until they are fully stable. If the patient was given a contrast media, they should be observed for signs of allergic reaction or side effect such as swelling or shortness of breathing. Other than that, the patient should be informed about any follow-up steps such as when and how to expect the result of their radiological examination. In addition, the result of the examination will be reviewed by the radiologist. The patient healthcare provider will contact the patient to discuss and recommend further action if it is necessary. If something abnormal are found, they will guide the patient on the next step, which may involve additional testing and treatment. Lastly, special care should be taken for the pediatric and elderly patient after the procedure, such as make sure they are comfortable, well hydrated, and have appropriate follow-up care. I think that's all for the patient care before, during, and after the radiological examination, and I think also that's all for my part.
Assalamualaikum and hi, my name is Munira binti Abdul Aziz and I am going to explain to you guys about hospital information system, radiology information system and picture archiving communicating system. Okay, first is hospital information system. What is hospital information system? It is defined as a complete and comprehensive integrating information system that manage a hospital administrative, financial and clinical operation. Okay, in a simple word, HIS is a computer-based system that helps to organize various parts in a hospital. For example, HIS store patient information such as patient name, age, medical history, diagnosis, drug allergy, and medication history. So, doctors or any medical professional have immediate access to patient entire history in just using one system. Okay, it is also managed to track billing and payment proposals. So it is easier to bill insurance to companies or patient. Next, the system also have inventory management. For example, when the hospital order drugs or medication or any medical supplies and it will arrive at the hospital, they need to key in all the information of the drug into the system, and the system will keep tracks all of the information, so they know the quantities of the drug or medical supply that left in the system. Okay, so this is the example of patient information system. As we can see here, at the upper part is where the important patient information like name and age, and on its right is the part where the drug allergy, if the patient have any allergy, and the below part is where the doctor will write all the patient symptoms and diagnosis. And it also have the part where it show medication history. This part show that what kind of medication that patient take or when the patient take the medication. Okay, next I will explain to you about radiology information system. It is defined as a group of software within a network for managing radiology network procedure, storing, modifying, and distributing patient data and images. In a simple word, RIS means a software that is used in a hospital to manage and store information related to radiology services. It is involved medical imaging techniques such as general X-ray, CT scan, MRIs, and ultrasounds. Okay, how the system works is, first, it helps to manage patient scheduling, patient medical data, and images efficiently. It can track where and when the procedure need to be done to the patient. It also keep records on patient imaging requests and scans results. For example, after the images is taken, radiologists will analyze the images and create a report. This system will help store and organize this report so doctor can access them whenever or wherever they want. It also track of every important details and gets up-to-date information. So as you can see in this figure, show one of the example of the radiology information system. It has all the patient information such as name, identification number, and date of birth. Okay, it also included the type of scan, date and time of the procedure, and also have the part where they store the images. So this system help doctors or any medical professional such as radiographer have immediate and quick access on the result. And these are the example of X-ray form. Okay, when a patient need to do a procedure, the doctor in charge will fill in this form. The right part is usually from the outpatient. Okay, next is a picture archiving and communicating system, or PACS. PACS is an efficient way to securely transport private patient medical imaging information. It is a computer system used in hospital and clinics to store, organize, and share medical images like X-ray, MRIs, and CT scan. This system make it easy for doctors to access the images quickly and securely without needing physical film. So this is the benefit of PACS. First is to improve healthcare. radiologist or doctor can look at the image online on a different part of hospital. So this increase the diagnosis process and enable them to make quicker and better decision and reports. Second is cost effectiveness. By eliminating the need for paper or physical film, the system reduces the healthcare expenses, which also reduce the use of physical storage space. Okay, the last one is to enhance image analysis. This system can help in modify medical images. To increase visibility, they can use this tool to zoom, rotate and change contrast on particular of the image. For example, images that have very tiny fracture or blood clots. Okay, this is the example of patient chest X-ray in PACS. As you can see, it is included the patient information and the image show can be zoomed, rotate or change the contrast. Okay, so the workflow is concluded like this. The patient is registered in hospital information system. Then the imaging order is processed and scheduled in radiology information system. And these images that are captured by the imaging modalities are stored in PACS. Okay, then the radiologists generate a report in radiology information system. The report and images are shared back to hospital information system for the referring doctor to access. So this concluded my presentation. This integration ensure efficient communication between the doctors and radiographer. It also reduce delay and improve patient care.